It's a very good question, and I think there is some concern that President Obama remained too silent during the course of the summer, particularly in August as things really heated up with the town halls. But there are several things to remember. First, single speeches obviously are not the be-all and end-all of policymaking. Very rarely have presidential addresses of any kind fundamentally shifted public opinion and shifted it in a sustained way. And so this speech has to be viewed as part of a larger campaign that will now be emerging to take control of the debate process again and try to craft it, refine it in a particular direction. That's number one. Number two, we in the policy-making world, those who actually do policy-making, the media who cover it, and the political wonks like us in the academic world, tend to focus on the day-to-day machinations of what happens. And it's really the larger social, political, and economic forces at play that are going to be the deciding elements. And one thing that we know, for instance, we may be paying a lot of attention in August, even when we're nominally on vacation. The American public, by and large, is not paying that much attention. Maybe enough to be a little scared now, a little skeptical, but not really deep attention. And this is the period in which that's going to be engaged, where the public is going to get much more involved in thinking about these issues. Third, let's think about this speech in the context of healthcare reform politics historically. You'll hear a lot in the media about how, well, Bill Clinton gave a speech to Congress and the numbers really went up and then they came down. There's one very important difference. Bill Clinton gave his speech essentially at the beginning of the process of engagement with Congress and the policymaking community and the public, and then the attacks came and all the things that were said and brought up and brought out and made up, frankly, in many cases. And certainly President Clinton suffered under that. And as we know, the whole healthcare process went down to defeat for lots of different reasons. In this case, President Obama has come to Congress, a joint session of Congress, not at the beginning of the process, but towards the end of the process, a time in which already all the slings and arrows have been cast at the general idea of healthcare reform, the kinds of approaches Obama has talked about and the Democrats in particular have talked about in Congress. And so any movement, any favorable movement, and there seems to be some, is coming after everything that could possibly be said and frankly made up has been already presented out in the public forum.